Assalamu alaikum viewers. In this video we shall talk about how does diabetes cause obesity. So let's move ahead in our videos and we shall see what is the interrelationship between diabetes and obesity and how diabetes causes this. So let's go ahead. So let's suppose this is a blood vessel, blood artery, and these are the RBCs, and you see here the oval shapes in G. It means glucose molecules, and the I shape ovals means the insulin molecules. So let's go ahead. For example, you have eaten something carbs like bread and wheat and whole wheat and bread and buns, any other bakery item which has sugar intake. What it will cause, it will increase the amount of glucose in the blood, and this glucose intake in the blood will increase. This will inject your pancreas, and your pancreas will secrete insulin hormone in the blood to shift this glucose load from the blood to its muscles or for fat storage and sugar storage. There are three methods that this insulin can get this glucose out of the blood vessels. The first one is sugar absorption in muscle for energy purpose, and it provides energy to the muscle cells. So how it occurs, the process occurs that let's suppose this is your cell of a soft muscle, soft tissue, and the cell has two channels. The first channel or gate, it is a gate of insulin where the insulin molecule comes and sits here, and it acts like a key of this lock, and this lock opens this hole or channel or gate, whatever you say. This gate is for the sugar or glucose molecule. So first insulin comes and unlocks the gate of the cell, and this gate is opened through which the glucose molecules in the blood are transferred into the cell. So by this means glucose is removed from blood, and the cell also gets energy. Glucose is energy giving molecule. So by this method your blood glucose level is reduced by the help of insulin. The other method by which this glucose can go away from the blood, can be removed from the blood, is the second one is sugar storage. And sugar storage is done in your soft tissues and your kidneys, your brain, and other such organs where the sugar storage is required for the body functions. And the total amount of sugar storage in our whole body in a normal person is 1700 calories. So sugar is stored as glycogen in these organs. What happens to the sugar or the glucose molecules which are left after sugar absorption in muscles and sugar storage? So what happens, that the excess glucose in our body is converted to deposited to liver, and liver creates the fat storage, and it deposits the excess of the glucose intake in your food as fat. So more and more glucose intake, so the more will be the fat storage. So what happens in a sugar patient? This procedure, this cellular absorption of glucose happens in normal person, but the persons having insulin resistance and who are the patients of diabetes, what happens in them, that their cells have insulin resistance. So when insulin molecule comes and sits here from the blood, so what happens, that it does not open this gate for the glucose intake, so this is closed. When this is closed, the glucose molecules from the blood cannot go inside the cell. They will be stopped here, and the gatekeepers will not allow them to go inside the cell. When this process of sugar absorption in muscle cells is stopped or reduced, what will cause? It will cause higher level of blood glucose. When your blood has higher level of glucose, so blood cannot retain your excess glucose in itself. It has to distribute the sugar by either of the method, either absorption in muscle, either sugar storage, or either fat storage. So the option which is most feasible in this case, in case of insulin resistance and diabetes, what will insulin do? It will open this gate, and your fat storage, you will accumulate fat in your belly. This will a pictorial representation is also here. So this is how you become fat due to diabetes. Another thing, and it is very important to mention here, that glucose and insulin both are equally responsible for the fat storage and the belly fat, because glucose and insulin, when insulin resistance occurs, it occurs due to our production of insulin from the pancreas, in case of when you eat medicines or you are injecting insulin through an injection in your body, and that is more than the amount of insulin required, then it will cause this glucose to go into fat storage. So both glucose, first the glucose and the second insulin, both are equally responsible for fat storage. What happens when your doctor advises you medicines for diabetes type 2 or diabetes type 1? What happens that they say that okay, take these tablets, take these medicines and eat whatever you want. They don't they forbid you from eating so much of glucose or carbohydrates. Every American daily eats more than 31 grams of carbohydrates daily, which is the root cause of such a burgeoning number of patients annually, that we have so many patients, millions and billions of patients of diabetes type 2 in America. So they tell you to eat more, and this eating more will cause a rise in the glucose level in your blood, and this glucose level will trigger the insulin production from the pancreas, and you eat more, you have more glucose, and you have more insulin in your blood. When you have more insulin and more glucose in your blood, and the glucose is unable to go to the muscle cells due to insulin resistance, due to this phenomenon, what will happen? The fat storage, this channel of sugar distribution or sugar metabolism or glucose metabolism in the body will increase, and you will have a hell of glucose molecules going to this channel, and this will cause you more and more obesity, and more obesity will mean that you will become a chronic and more chronic patient of diabetes. So actually the medicines are a perpetual cycle of creating causing the disease more. The sugar medicines, the diabetes medicines will cause you to become more fat, and what doctors say you that this is your fault that you have become so much obese. Actually this is not only your fault, or not only the fault of patients. This is equal responsibility of the doctors and the healthcare system, which has no other remedy for diabetes to treatment. And actually if we amend our behavior, eating behavior, if we reduce our carbohydrates and increase healthy fats in our body, which have very little or no amount of carbohydrates, no amount of glucose, they can better help us with our diabetes type 2 control or reversal, whichever is applicable. Till next video, take care. We shall keep uploading such videos, such informative videos for you. And do like and subscribe my channel, and give your feedback in the comment section. Take care. Allah Hafiz.